Good evening, everybody. For those who have joined, kindly write down your name. Let me know the ones that have joined. Let's begin. The earlier we start, the better. Okay, so let's begin. If you're here, please write down your name. Okay, Jabir is here. You're welcome. I can see two other people. Please write down your names, please. I can see two other people. Okay, so let's begin. We still have not much, only few people are alive. Let's give some time for other people to join so that we'll start. We need to use our time wisely. So I'm only going to give 5 minutes. Whoever is not here will start. So as it is. Yes. So as it is, there's only 2 minutes more. Only 5 minutes after time we start. Please kindly inform your other colleagues so that they will join. We are about to start. Because so far I'm seeing only few people. So apart from Jabir, who is here again? Please write on using the chat column, or is it chat box? Identify yourself, please. Anymore. Today will be our Okay, so we can see Hafsat is here, Fatima is here, Aishur is here, Abdul is here. Okay, so let's go. For today will be our last mock, because I think next week you people are likely finishing the posting. Okay, W is here. Okay, all right, so let's begin. The first question is for nephrology. Today we'll be dealing with some questions in nephrology and gastroenterology. You know that this mock is more of a guide to guide you on your reading pattern. So the question says the following is not a cause of proteinuria. So we're talking about proteinuria, which is not a cause of proteinuria. Is it urinary tract infection? Is it diabetes nephropathy? Is it vigorous exercise? Is it amyloidosis? Or none of the above? What is the answer? Please write in the comment section what you think the answer is. Okay, Patience is here also. Okay. Mohammed Ahmad is here. Okay. All right. So what's the answer? Anyone? You know, you did investigations in nephrology, basic investigations in nephrology, and one of the investigations that they do in nephrology is urinalysis. So you can see proteinuria. So which one is not a cause of proteinuria? Any answers for me? I'm going to give you 1 minute. After that, I'll answer. Okay, I've said vigorous exercise. Okay, who else? Which one is not a cause of proteinuria? So these are basically simple questions, okay, for your level. Okay, I'm not seeing more answers. Any more answers? Okay, Abdul also said vigorous exercise. Okay, so the answer is none of the above. All these will give you proteinuria. The vigorous exercise, the amyloidosis, the diabetes nephropathy, and urinary tract infections, they will all give you amyloidosis. They will all give you proteinuria, sorry. They will all give you proteinuria. So the answer is none of the above. Okay? The answer here is none of the above. Vigorous exercise especially those who engage in intense exercise, they may see protein in urine. So the answer is none of the above. All right. Okay, so let's go to the next one. So the next question says, which of the following defines microalbuminuria? Okay, you know we usually check albumin in urine. So the question here is, which one defines microalbuminuria? Is it albumin of less than 30? Is it 30 to 299? Is it 300 and above? Or is it 400? So which one of the following defines microalbuminuria? So kindly answer if you know the answer. You know there is micro, there is macro. Okay, I should have said A. I'm seeing A. Fatima said B. Okay. Any more answers for me? Any more answers for me? Okay, Afsat said B. So the answer is B. A, less than 30 means it's normal. When it's less than 30, it's normal. But when it's 30 to 299, is microalbuminuria. So it's B. The answer is B. For those who got B, yeah, that's the answer. Less than 30 is normal. So similarly, the next question is, which of the following defines macroalbuminuria? If it is macro, is it less than 30? Is it 30 to 299? Is it 300 and above? Or is it 400 and above? So the next question, which one defines macroalbuminuria? Macro. You know the answer? Kindly answer it. Okay, I'm seeing C, C, C. Very good. So the answer is C. Macro is when it's 300 milligram per gram and above. Okay, it is very important that you know the difference between microalbuminuria and macroalbuminuria. So you must know the difference. Okay, so this one is macro. That's C. C is macro. So that 400 is just to fill up my questions. So less than 30 is normal. 30 to 299 is micro. Then 300 and above is macro. Okay. So let's go. I said here, fatty cast is seen in which condition? Okay, you know, when they do urine microscopy, there are different casts that you see, and those casts that you see are suggestive of certain types of diseases. Okay, so fatty cast is seen in which condition? Nephritic syndrome, nephrotic syndrome, UTI, tubular injury. When do you see fatty cast? If you know the answer, kindly answer. So question 45. When do you see fatty cast? Any answers? Okay. Here they said is someone said A, that is nephritic syndrome. Any other answers? Any other answers for me? Someone said B, B, B. Fatima said B. Ibrahim said B. Mona said B. Okay, so the answer is B actually. You see it in nephrotic syndrome. Okay, very good. So the next question is, broadcast is seen in which condition? Okay, broadcast is seen in which condition? Is it nephritic syndrome, nephrotic, UTI, tubular injury, end-stage renal disease? When do you see broadcast? When do you see broadcast? Okay. Any answers for me? When do you see broadcast? Okay. Ibrahim said C. Okay. Any other person? Okay. So, okay, someone say A. So broadcast is seen in end-stage renal disease. It's end-stage renal disease that you see broadcast. Please take account of this. You need. Someone said E. Well, of course, exactly. That's the answer. Okay, so let's move. Okay, Fatima said E. Okay, E. All right. So next one, 47. Let's move forward. White cast is suggestive of what? Nephritic syndrome, nephrotic, UTI, tubular injury, end-stage renal disease. The same options, but which one suggests white cast? Which of this disease condition is suggestive when you see white cast? Okay, any answer for me? Which one is suggestive? Okay, Mahmoud Musa said C. Okay. Any other person? Fatima said A. I saw A. I saw A. Okay, so A. So actually, the answer is C. It's in UTI, where you have leukocytosis that you likely see white cell CAS. Okay, so the answer is C, UTI. Okay, very important. All right, so let's move. 48. A syndrome from glomerular inflammation characterized by hematuria, proteinuria, and hypertension. What is the answer? Is it nephrotic syndrome, nephritic, chronic kidney disease, glomerulonephritis? What is the name of the syndrome from glomerular inflammation characterized by hematuria, proteinuria, and hypertension? What is your answer? Any answers for me? Okay, Salim says A. Any other person? Okay, Yusuf also said A. Any other person? Okay, Ibrahim said C. Okay, I saw Yusuf said B. Okay, so let's move forward. The answer is actually B. The nephrotic syndrome doesn't have hematuria and hypertension. So the answer is actually B. Is the one is nephritic syndrome that comes with hematuria and hypertension, not nephrotic syndrome. So the answer is B. Okay, because I saw that they taught you nephrotic syndrome in the timetable. That's why you're seeing a lot of it. So while a syndrome characterized by massive proteinuria, dyslipidemia, and body swelling is what? Nephritic syndrome, nephrotic syndrome, CKD, none of the above. So what's the answer for 49? What's the answer for 49? The syndrome characterized by massive proteinuria, dyslipidemia, and body swelling. Okay, Khadija Ahmed said B. Yusuf said C. Patient said D. Okay. Any other person? So the answer is actually B. This is the definition of nephrotic syndrome. The proteinuria is massive, usually greater than 3 grams. As dyslipidemia, there is anasaka, massive body swelling. Okay, so the answer here is B. This is nephrotic syndrome. So it's very important that you differentiate nephritic from nephrotic. While nephritic, we are dealing with hematuria, hypertension, proteinuria. Nephrotic, proteinuria, dyslipidemia, body swelling. Please try and differentiate it. So the answer is nephrotic syndrome. That is B. The answer is nephrotic syndrome. That is, you know, both nephritic syndrome, nephrotic syndrome, they are all spectrums in CKD. But here I specifically say a syndrome. And when I say syndrome, I mean either nephrotic or nephritic. And this is nephrotic syndrome, please. Okay. Okay, so the next question is the following are found on urinalysis for a patient with nephritic syndrome except. So if a patient has nephritic syndrome and you do urinalysis, are you going to see A, hematuria, B, proteinuria, C, red cell CAS, D, acanthocyte, and E, white blood cells? Which one will you not see in nephritic syndrome? Any answer for me? Which one are you not going to see in nephritic syndrome? Remember the components of nephritic syndrome. So which one is strange here? Always learn to look for the one that is odd, that is out of place. That's how to answer best of 5. There's always one that is out of place. So which one will you not see if you do analysis for nephritic syndrome? Okay, Fatima said E. Okay, I see D. So if you see that acanthocyte, though it looks strange and you likely carry it, but that's wrong. The answer is E. You remember we said white blood cells are only seen in UTI. White blood cells are seen in UTI. Don't forget, we said white blood cells are seen in UTI. Okay, so that's the odd one. Acanthocytes are just denatured red blood cells. So the odd one, since you have the knowledge that white blood cells are seen in UTI, and now you're talking about it in nephritic syndrome, you know that that's not the answer, isn't it? Okay, let's move. Then the next one is urinalysis findings in nephrotic syndrome patient. Which one is true? Is there proteinuria, lipiduria, that's lipid in urine, A and B, none of the above. So which one is the answer here? So which one is seen in nephrotic syndrome? We just did nephritic syndrome with the analysis. So nephrotic syndrome, which option is it? Proteinuria, lipiduria, A and B, or none of the above? Okay, so it's very important that we are doing this mock. So in nephrotic syndrome, because of the way the glomerulus have been denatured, even lipids are leaked in the urine. So the answer is actually C. The answer is actually C. Okay, so because both proteinuria and lipiduria are seen, so the answer is actually C. It's not only proteinuria. So the answer is C. Okay, so if you mention A, you are right, but not completely right. The mock exam is best of 5. So we are not saying you are not right, but which one is the best option among the options? Okay. Okay. So are you with me so far? If you're with me, say yes sir, yes sir, yes sir. If you have any question, please ask now before we continue. If we are to go ahead, say yes sir, go ahead. I think we're almost halfway. So if you're okay, say yes sir, go ahead. If you have question, please ask. Then I will continue. Where did I stop? Okay, so yeah. All right, so you people are here. Good. So let's go. Where is the next one? Okay. For the response. So the next one is post-streptococcal glomerulonephritis occur after infection with which? Okay, Khadija, we said that no, it's majorly UTI, right? It's majorly UTI that you see white blood cell cast. For your level, please no UTI alone. Nobody will ask you beyond UTI. Please no UTI alone. Okay. So this one we said post-streptococcal glomerulonephritis occur after infection with group A beta hemolytic streptococcus, group B beta hemolytic streptococcus, strep pneumo, none of the above. So which one is the answer for 52? Let's answer it. Okay, Mahmoud said B. I should say A. Okay. Who else? Okay, I should say A. All right. Yusuf Ahmed say A also. Okay, so all right, Mona said B. So the answer is actually A. Group A, beta hemolytic streptococcus is A. So that group B is just to confuse you, so that I want to be sure that you know it. So the answer here is A. The answer here is A. So the next question here is number 53. At which age group is post-infectious glomerulonephritis common? That's the post-streptococcal glomerulonephritis. At which age? Less than 5, 5 to 15, 20 years, 40 years. At which age is the PIGN common? Post-streptococcal glomerulonephritis or post-infectious glomerulonephritis. At which age is it common? Okay. Any answers? Okay. I see patients wrote D. Anyone? Any other? Okay. Okay. Fatima wrote A. Okay. Any other one? So the age actually is 5 to 15 years. The age is 5 to 15 years. That's B. Okay? 5 to 15 years from childhood to adolescent. Okay, so let's move. 54. All this one, trying to see if you paid attention during your lectures about glomerulonephritis. And you know the most common in this environment is the post-streptococcus or post-infectious. Okay? Because of the high degree of infection, which is not common over there. Though, you know, there's difference between glomerulonephritis and glomerulopathy, which diabetes and hypertension may be caused. But let's go. Let me not dwell on it. So that I will not go too deep for you. So, which of the following is the laboratory finding in a patient with the post-streptococcal glomerulonephritis? Is there a decrease in anti-streptococcal O level, that's the antibody, or it is normal anti-streptococcal anti-streptolysin O level? Do you have elevated C3 level, or you have proteinuria? So which of these laboratory findings is correct? Any answers? If you do post-streptococcal, what will happen? I think I should answer this one myself. Okay? Or anybody that has the answer can go ahead before I answer. Okay, so let me go ahead and answer. So number 54, the answer is proteinuria, because the C3 level, right, it should be low. The anti-streptolysin level is usually elevated. So usually the picture you see is proteinuria, low level of C3, and elevated antibodies against the streptococcus. So it is elevated. So the answer is D here. The answer is D. The C3 levels are decreased. It's also a catch that you think that since it's autoantibody process will be elevated. No, it's decreased. What is elevated is the streptolysin O antibody. So that's what is elevated. So the answer is proteinuria. Remember, let me say it for the last time. There is proteinuria, low level of C3, and increased antibody. So we are at CKD. Okay. The question here is, which of the following is a modified risk factor of CKD except? So which of these is a modifiable risk factor for CKD except? So which one is not? Diabetes, hypertension, history of AKI, frequent NSAID use, adult polycystic kidney. So which one you can't modify? Which one is the answer? Let's go ahead and answer. Which one you can't modify? Okay. 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 Very well. You should know this very well, that AKI is reversible. AKI is reversible, right? So it is modifiable, right? But if you have adult polycystic kidney disease, you cannot change it because it is genetic. Okay, so Mahmoud and Yusuf are right, so the answer is E here. So the next question is, I'm assuming that you know the stages of CKD using EGFR. If you don't know it, the Korotkov-Gold formula, you must know it. Please learn it. Okay, learn it. So the question here is, which stage of CKD does complications begin? The complications of CKD, is it 1, 2, 3, 4? Okay, sorry for the typo. D should be 4, then 5. At which stage do you start seeing complications? Okay, Mahmoud said C. Any other one? Mahmoud said C. Okay, Yusuf also said C. Fatima said C. Mona says D. Okay, so the answer is actually C. You're all right. It's from stage C. I'm assuming that you know what the stage C is. Please, if you don't know, try and know. Okay, so we are through with nephrology. We are going into gastroenterology. So please pay attention. So which of the following is not true when defining diarrhea in adults? So which one does not define diarrhea in adults? 3 or more loose stool per day, 3 or more liquid stool per day, more frequent stool for the individual. So the individual is passing more frequent stool than he used to. Then none of the above or all of the above. So which one doesn't define diarrhea in adults? Any ideas? You know, you had lectures on diarrhea. I'm hoping that you know the definition of diarrhea. For any answers, which one doesn't define diarrhea? Okay, I'm seeing D. Okay, so very good. For those who wrote D, you are absolutely right. Okay, because all ABC actually defines the area. So none of the above definition is wrong. So the answer is D. You're all right. Okay, very good, very good. Good. Acute diarrhea, 58. Okay, let's go to 58. Hope you are all with me. Let's go to 58. Okay, sorry, just a minute. Let me try and fix something. Okay, so 58 says acute diarrhea is a diarrhea lasting dash. So 58 says acute diarrhea is a diarrhea lasting dash. So less than 7 days, less than 14 days, 14 to 30 days, more than 30 days. Okay, so we have okay, Mona say less than 14 days, which is right. Okay, I should also Binta, Ibrahim also, Fatima also. So the answer is B. That's acute diarrhea. Okay, so let's use the opportunity to answer what is what is it? So acute diarrhea is the one between 14 to 30 days, while chronic diarrhea is the one more than 30 days. Okay, please have that in mind. So acute 14 to 30 days, chronic more than 30 days. Okay, so let's use one stool to kill two birds. Hope you guys will remember. All right, the next question: the following are causes of mucous stool except. So which of the following doesn't cause mucous stool? Entamoeba histolytica, Salmonella typhi, Campylobacter jejuni, then enterotoxigenic E. coli. So which of the following doesn't cause mucous stool? Any answers for me? You must know diseases that cause watery stool, diseases that cause mucous stool, diseases that cause bloody stool. You must know it. As a doctor, there is no escape route for you concerning this stuff, especially when it comes to gastro. So any answers for me? Any answers for me? Okay, I think I should answer my questions. So here, okay, I'm seeing D. Okay, Mahmoud Musa said D. Okay, Mona said B. So the answer is actually D. The enterotoxigenic does not cause mucous stool. Okay, so but Amoeba histolytica is the one that causes amoebiasis. It can cause it. Typhoid can cause it. Campylobacter jejuni can cause it. So enterotoxigenic does not cause it. Enterotoxigenic causes watery stool, just like cholera. Okay, it causes mucous stool just like cholera. So the next one is here. Which of the following causes bloody stool except shigellosis, enteroinvasive E. coli, amoebiasis? None of the above. So which of the following causes bloody stool except? So which one doesn't cause bloody stool? Any answers for me? Which doesn't cause bloody stool? Okay. And see, Khadija said C. Any other person? Okay, so Khadija is right. The answer is C. Because earlier I told you that Entamoeba histolytica causes mucous stool, and Entamoeba histolytica causes amoebiasis, isn't it? So the answer is actually C. Number 60, the answer is C. Because Entamoeba histolytica is the one that causes amoebiasis, and it causes mucoid stool, not bloody stool. Okay, very, very important. You must go and revise this thing. All right, the other one is the following cause is watery, non-bloody, non-mucous stool except. So 61, cause watery, non-mucoid, non-blood is 2? Which one causes non-mucoid, non-bloody, watery stool? 61. Okay, so here I say Staph aureus, Bacillus cereus, enterotoxigenic, E. coli, none of the above. Which one is the answer? Which one is the except? So I'm seeing C. I'm seeing C. I'm seeing. Well done. Okay, so earlier I said the enterotoxigenic E. coli causes a diarrhea similar to cholera. Cholera is also non-mucoid, non-bloody, right? So Bacillus cereus is also watery. There's no mucus, there's no blood. Staph aureus, if you cause any infection, is also watery. So the answer is none of the above. I told you earlier that enterotoxigenic causes watery stool just like cholera, and cholera is watery. There's no blood in cholera, neither is there mucus in cholera. So all these three that I've mentioned above cause watery stool. So the answer would be D. Okay, the answer will be D. I don't know to what extent they taught you, but you are supposed to know this. You are supposed to know this. Okay, because these are basic knowledge. It's not even a complicated knowledge, but basic. So you are supposed to know. Okay, so the answer is D. The answer is D. Let's go. 62. 62. Okay. I hope the way they taught you was using slides so that you can see, you can go and revise what you have done with your lecturer. Okay, very important. So acute viral hepatitis is defined as acute inflammation of the liver of what duration? Acute viral hepatitis number 62. Okay, acute viral hepatitis, is it less than 6 months? Is it more than 6 weeks? Is it more than 6 months? Is it less than 6 weeks, or none of the above? Which one is acute viral hepatitis? Which is acute viral hepatitis in this option? It's like some people are lacking behind. Maybe it's due to their network. So if you are answering, please write the number, or like someone did 61C. So you can just write 62 this, so that I'll understand which one you're answering. So what is acute viral hepatitis? Okay, Mahmoud say A. That's less than 6 months. Any other person? Okay, Caleb also say A. I should say A. Okay, of course the answer is A. It's when it's beyond 6 months that is chronic. So the answer is A. You're right. So 63. If you're answering, you write the number. Let's go to 63. Let's go to 63. So 63 says the following are causes of acute viral hepatitis except hepatitis B, hepatitis C, hepatitis A, cytomegalovirus, none of the above. So 63, what is the answer? 63, what is the answer? Okay, I'm seeing D, I'm seeing C, I'm seeing A. See different answers. Okay, I'm seeing C. So what acute viral hepatitis means is the acute inflammation of the liver caused by a virus. So which one is the answer? So the answer here is E, because both cytomegalovirus, hepatitis B, hepatitis C, hepatitis A can all cause acute viral hepatitis, right? Hepatitis B doesn't go straight to chronic viral hepatitis, neither does C. They start causing acute, okay, before going to chronic, okay. So it is none of the above. All of them will cause acute viral hepatitis, please. Okay, so the next one, question 63. Which of the following is what the following are causes of chronic liver disease except? So chronic liver disease, okay, hepatitis B, hepatitis C, methotrexate, Wilson disease, paracetamol. So which one does not cause chronic liver disease? Okay, I'm seeing B, I'm seeing C. Okay, sorry, my charge is low, so I'll be answering very fast. Almost true. Okay, so the answer is actually E. Wilson disease is a problem with copper, and it is one of the metabolic causes of CKD. So the answer, paracetamol only causes acute viral hepatitis or liver failure. Methotrexate is one of the drugs that cause chronic kidney disease, together with methyl dupa. Okay, hepatitis C and hepatitis B, you people already know that. Okay, so the answer is E. Okay, then 60, this should be 65, the last one. The following are causes of hepatoma. Hepatoma means PLCC, except aflatoxin, hepatitis B, hepatitis C, smoking, none of the above. What is your answer for 65? Causes of PLCC. Causes of PLCC. Which one is your answer? Okay, as I said, my battery is down. It's about to die. So I will have to answer this last one. So the answer is none of the above, actually, because smoking puts your hair, Mahmoud got it, put you at risk. So is hepatitis C, hepatitis B, and aflatoxins. So I want to thank you all for participating since the day we started. I want to wish you the very best in your mock. Please try and read all the lectures they have given you. If you want to watch this video, it will always be in my YouTube channel. I wish you the very best.